Database that tracks the path of every pain pill sold in the U.S. has recently been made public by the Washington Post.
It is helping shed more light on just how this epidemic grew. Local 44's Devin Bates spoke with an expert tonight at UVM Medical Center, and he joins us now in the newsroom with more details. Devin?
Well, Lauren, this data goes county by county and details the exact number of pain pills that were prescribed, as well as who made and distributed them. It covers 2006 through 2012, a period when over 100,000 people died from this crisis. A snapshot of a nation in the middle of a growing public health crisis. The Washington Post has released 7 years of data from the DEA tracking the path of every opioid pain pill between 2006 and 2012. The county-by-county data shows a region in the South where overprescribing and opioid-related deaths were highest. Meanwhile, in Chittenden County, there were over 35 million pills prescribed, and you can even see the primary distributors and manufacturers. I spoke with Maureen Leahy, the Director of Neurology and Psychiatry at UVM Medical Center, to get some insight on what the healthcare system was like during that time.
It was a period of time where there was a different kind of emphasis on pain management, both from the way medicine has been practiced and from a regulatory standpoint. We recognized that the prescribing of opioids had gotten way out of hand and was becoming the default treatment.
In 2016, as Vermont and the rest of the nation were fully aware of the scope of this epidemic, UVM Medical Center also started tracking data on prescribing, specifically targeting larger prescriptions.
When we started looking at it, part of our goal was to understand the patterns, to make sure that like providers had similar patterns. So if there are 4 providers providing the same service and one of them stands out, it really is incumbent on us to ask the question why, share the data with the provider, and help them come in line with the prescribing practices of their colleagues.
The Washington Post is fighting to get more recent data released, and Leahy said it could be beneficial in optimizing the state's innovative treatment model.
As a state, it's helpful for us to look at it county by county, because then we can make sure that we have the right resources in the right locations. So Vermont has a very well established and well-known hub and spoke model. If all of the hubs are in the counties with the lowest prescribing, that's maybe not the right match.
Now, the next set of data the Washington Post is attempting to release is from 2013 and 2014. If you want to learn more about this database, you can click the link under this story on our website, mychamplainvalley.com. Live in the newsroom, Devin Bates, Local 44 News.